Great, thanks, Natasha. I'm Caitlin McGraw. I'm the Environment Section Counselor, one of the Environment Section Counselors for the APH Environment Section. And I'll be leading and facilitating the panel today. I'm a postdoc researcher at Columbia in environmental health. And today we're highlighting people working in city and state health departments and specifically doing environmental work. And so we're so excited to highlight these people today, and we can talk about other opportunities or future positions you might be interested, or even collaborations or anything like that. So I'm gonna just briefly say each person's name, and then I'm gonna let you all introduce yourselves briefly. But we'll be having Adriana Azarias, who works for the NYC Health Department, Bureau of Environmental Disease and Injury Prevention. I see her here, iPhone. And then we also have
here.
Candace.
Hi.
Oh, thank you. Hi. I'll have you introduce yourself in just a second. We also have Candace Dunlap, who's doing her PhD degree at the University of Alabama right now, but she's also the public health director for a tribal nation, I believe, the Ho-Chunk Nation Department of Health in Wisconsin. Oh, there you are, Candace, hi. And then we also have Justin Garut, who works as the director of the Office of Health Equity at the New Mexico State Department of Health. And I know they previously worked in a more environmentally focused position. So hi, Justin. Welcome to all of you. We're so excited to have you today. And if you would just each go around and give a brief introduction and maybe talk about a typical day in your position and what that looks like from the environmental health perspective, and I'll be fielding questions, and we'll just start with a quick discussion right now. So whoever wants to start, or I can choose. Or I can start with Adriana, is it Andy you said you like to go by?
Yeah. Yeah, I could go by Adriana or Andy for short.
Andy.
Yeah, no problem. But thank you so much for having me here and being able to join you all today. I just joined the group about a little less than a year ago, so it's nice to actually be here and getting to meet and see different faces that I've seen in the email threads. But let me know if you can hear me okay, because you were breaking up a little bit, and I'm not sure if it's my connection. But I will introduce myself. I work with the New York City Health Department. My title is Senior Advisor on Strategic Planning and New Initiatives within the Bureau of Environmental Disease and Injury Prevention. So I basically help oversee new initiatives. I help weigh in on policy proposals, develop policies related to our work. My specific focus is on the indoor home environment. So a lot of focus on home health hazards, which is a very fluid concept, and it has kind of expanded to include resilience, sustainability, and climate related issues. So it's just a really exciting time to be working in the City Health Department, because it is such an innovative place, and it's a place that just clearly values just forward thinking, innovative initiatives. So happy to discuss more as we keep going with the panel, but I'll let others introduce as well.
Thank you, Andy. Candace, would you like to go next and just describe your role and maybe what a typical day is like for you?
Sure, absolutely. Hi, my name is Candace Dunlap. I am the brand new public health director for the Ho-Chunk Nation, which is a tribe in Wisconsin. It's a brand new division that we're sort of creating from the ground up, and pulling from the Environmental Health Division, which is well established, and the Community Health Division, and sort of teasing out true public health stuff. I've only been on the job about 2.5 weeks. But I interned with the organization back in 2017 when I was still in my undergrad. So I bounced between environmental health and community health. So it's kind of come full circle where I'm doing this in a much bigger role now, and pulling public health from both of those. The Ho-Chunk Nation is a tribe in Wisconsin, and we serve 15 counties where tribal members live in the state of Wisconsin, and one county in Minnesota. We have tribal members all across the nation, and so they're sort of our at-large individuals that don't seek our services in person as much as the ones that are in our counties. But we have 2 ambulatory clinics, and we have 5 satellite health offices. We also have a food distribution center and a central health office. So we do a whole comprehensive health and wellness, from clinic settings to public health settings to environmental health settings. Our environmental health program is absolutely amazing. We do all wastewater, air quality, indoor and outdoor radon screenings, especially being in the Midwest where a lot of people have basements. There's a ton of stuff that they do, and I'm happy to explain a little bit more. But my role is sort of pulling out the public health stuff of both of those, so things like injury prevention, infectious disease kind of stuff. Nice to meet you all.
Thanks, Candace. Congratulations on your new position. Justin, would you like to go next?
Hey everyone, can you hear me? You can hear me, okay. My name is Justin Garut. I use they or he pronouns. I am the new Health Equity Director at the New Mexico Department of Health. Formerly, for the past 2 years, I worked at the New Mexico Environment Department as the Director of Strategic Initiatives. And I'll tell you a little bit about both of my roles, just so you know what questions to ask, I guess. At the Environment Department, I was working as a governor's exempt staff, so part of her team. And I led the state's wastewater tracking for SARS-CoV-2 in congregate settings across the state. I also led our employee engagement efforts, so tracking internally how engaged employees are to work on retention. I oversaw all of our legislative initiatives at the state level, so every legislative session tracking all of our priority bills for the department. Also oversaw our performance metrics, both our internal ones and those that we negotiate with the legislative branch and the Department of Finance. 2 more things. I oversaw constituent services. So anytime a constituent wanted to get more information related to the Environment Department, whether it was septic or water quality or air quality or hazardous waste, or our oversight of the federal agencies here in the state, we were the ones to help guide that. And then finally, I oversaw all of our NEPA comments on public letters from the department. So it was a big job. I enjoyed it. I shifted over to the health department though to be more, or to be closer, I think, to like what I would say is core public health work, or to be working with more people who use a public health mindset, maybe is the better way to frame that. I often felt at the Environment Department, I was the only one, talking through this public health lens and thinking through the social determinants and whatnot. So I've been at the Department of Health now for 6 weeks, and I'm switching into a career position, so a more permanent position, depending on how the election goes this fall for the governor. And here I'm really working on overall trying to institutionalize health equity in the department. We've surveyed all of our employees, and there's a lot of folks who are like, I don't do that. No, we don't do health equity. Like, I work in facilities. I don't, it doesn't involve me. Or I work in administrative services. I do the budget. We don't do health equity work. And so we have a lot of work to do to try and like get folks on board and convince folks that yes, you do health equity work, regardless of where you are throughout the department. Also leading the public health task force, which was mandated by the legislature to look at the New Mexico public health infrastructure and recommend key changes to improve it and to improve health equity across the state. So we've been meeting with a huge team and are about to release our draft report on June 1st for public comment. And part of that includes a big recommendation on climate change and health and trying to create a more formalized climate and health program within the Department of Health. I'm also overseeing we have an executive order from Governor Lujan Grisham to collect sexual orientation and gender identity demographic data in all state agencies, internally and externally. And so I'm working to help coordinate among all of our state agencies how to best go about collecting this voluntary data so that we can better support our sexual and gender minority communities. And as far as I know, we're the first state to take this broad statewide approach to integrate it into every state agency. Last thing is language access. So we're trying to do better about providing language access services both internally here at the Department of Health and externally. Right now, it's kind of piecemeal. There's not really an office of language access, and I'm trying to change that. So the taste of what I do, I'm in Santa Fe. For context, I'm about 10 miles from the largest wildfire that's currently burning in the US, right? So there's a lot of heaviness in terms of what we need to do environmental health and public health wise to plan for, mitigate, and support our communities who are on the edges of this fire. And I'm happy to be with you all. Y'all are a good group. I hope to stay in touch even though I'm no longer at the Environment Department. Thanks for the invitation.
Thank you so much, Justin. And thank you, everyone. It's so interesting to hear how different your work can be, even for each person, and then between each of you, for a tribal community with multiple counties, a state level position and a city level position, with oversight and policy. It just shows how versatile people who work in environment and also your jobs can be. So many great topics and so much great work. I know that we all often have some heaviness to our work, but I'd like to know what each of you is excited about in your work that you do, what excites you about your job, and yeah, I know that it is heavy, but I think it's exciting to see this work being done. So whoever wants to start.
I can go first, but hopefully, this can be, an informal kind of discussion. But I would just have to say, this is probably why everyone in our field is in this field. It's just such a sense of purpose, where you're going into your day every day and you're going to be doing something that you're aiming to benefit the greater good. So I think it's the closest you can come to. In my case, I always knew I wanted to work in the public sector and do something related to public good. And this is just one of those tangential ways where you can feel some sort of accomplishment, no matter how small your accomplishments can be, and no matter how frustrating sometimes things can feel with bureaucracy for those who work in bureaucratic environments. But you try to just overlook those and try to push forward with what is a good agenda, and that being in the public interest is something that will ultimately hopefully translate to a better living environment for the population you serve.
I can jump in. I have been in the academic realm for the last 5 or so years, and one of the things that I'm most excited about is coming in as a fresh face and sort of a morale booster. We've been in crisis mode for the past 2 years, and our employees, our public health folks are tired. In academia, we are as well, but sort of this change and this transition is coming in to sort of bring morale up. We're excited to start getting back to some of the true public health prevention stuff that we're doing instead of constantly being in crisis mode. We have an amazing strike team that has been doing COVID testing, and we actually do a test to treat model here and provide clinics all over. But one of the things that I'm really excited about is to sort of just come in and be a fresh face and do true public health prevention work, but also to support the other divisions in a new era outside of academia into the actual practice itself.
What a hard question. I'm excited about a lot of things, right? Like I like doing the SOGI data collection, the sexual orientation, gender identity data collection stuff, because it's near and dear to my heart as a member of the community. But I think like, I don't know if it's like what I'm most excited about, but what I'm trying to do in this new role is to always bring like the human element to our meetings. I don't know how many of y'all have worked in state bureaucracy or federal, and maybe it's similar, but I feel like our meetings are often very professional and we do things a certain way and we, you know, like use that professional speak. I feel like that human element is sometimes missing, and I feel like my theory is we can make better decisions related to policy or community work if we're able to kind of bring our whole selves to the table. So like, you know, we were in a discussion on ACEs the other day, and I brought in like my score on ACEs and talked about how I could have used a school-based health center had I had one in my community growing up, and how important it is that we create more of them in New Mexico. Or, you know, talking with the WIC program, the Women, Infant, and Children program recently, like I didn't know fathers could get WIC, right? It's very like in my mind, I was a WIC baby. My mom used WIC. I remember going to the stores and using the WIC check to try, like she kind of made it a game for us to figure out what foods we could buy. And I don't know, I feel like if I can bring that and like help other people be more vulnerable maybe, or just open in our conversations, I hope we can make better policy and I guess interact with our programs and community in a way that helps dispel that kind of like, oh, you're a bureaucrat, right? Like I'm actually a member of the community. I grew up not too far from here, and like that's what I'm trying to do. And I feel better in meetings when I'm engaging in that way, but it always also doesn't feel safe to engage in that way in meetings. So something I'm excited about and challenged by at the same time.
That's great. Yeah, trying to sum up each of your responses, you know, it's so nice to hear everyone excited about different things in their field and bringing morale and like bringing your whole self to the table, and seeing how we can affect change just and how we work with people. So I want to follow up with like, what are some of your challenges in your roles, and like just every day or in your position, what are things that you all are facing in your work?
Should I go ahead?
No requirement for you to go first every time. But.
The one thing that I always bring up, and I think y'all have heard it before, is our vacancy rates within the state of New Mexico right now. You know, at Environment Department, we were missing a quarter of our team, so 25%, and that work is falling on other people, or it's just not being done, you know. And like at the Environment Department, we have one person with 0.2 FTE, so like 6 hours a week or something, dedicated to environmental justice for New Mexico. I think it's a disgrace. I don't think it's right. And I while I was there, did everything I could to try and push an EJ program forward and wasn't successful. But here at the Environment Department, it's the same way. We're missing 1,000 people. Fully staffed, we're at 4,000, and we're missing 1,000 folks. And it's hard to retain folks. We don't have the salary structures that are competitive enough. And I think that's the biggest challenge, is trying to like build back up when we were defunded under previous administrations, but also knowing that even if we got a ton of money right now, I'm not sure that we could easily bring in the 1,000 people we need to do the critical work. That's the biggest challenge I think we're facing here in New Mexico.
I'm gonna pause the panelists and first note Megan's comment in the chat. Justin, if you want to post any positions or share them with our leaders, our section leaders, and then Raquel, if you want to go ahead and ask your question.
Thank you. Yeah, I actually Justin kind of responded to what I had in my mind, but it was basically why this 25%? Is it just the money, or are there other challenges, and how could we approach those challenges? I mean, funding is usually a terrible burden, but is it just the funding? Also, I think there was an interesting question from Elena on the chat that we might also want to talk about. But yes, Justin, that was my question for you. Why the big vacancy number?
Yeah, that's a good question. In our employee engagement metrics at the Environment Department, the thing that 50% of folks said was better pay. I need to feel valued. I need better pay for our work. Some of our folks here in New Mexico were making less than $15 an hour until the last legislative session. Honestly, I think that's the biggest thing. I think more folks would feel valued and supported and be able to put food on their table. I have an employee who told me recently, like, I can't keep up here in Santa Fe with the cost of living and what y'all are paying me. And now I need to try and do something to try and support them within our constraints, like our pay band constraints. I can't just, give them a raise like I could maybe in a private company. It's not that easy. But in my mind, that's what's coming up and is at the top.
Yeah, thanks, Justin. Oh yeah, I want to go ahead and finish out this question about challenges in your job, and then we can talk about Elena's question next. So go ahead, Candace.
I would like to reiterate that our employee satisfaction surveys, the number one thing is also pay. So it's across the board in state health departments, tribal health departments, public health, environmental health in general. It comes down to people being able to afford to live. So in our employee satisfaction surveys, it's the same thing as well. Challenges mostly for us right now, which part of my role is to come in and alleviate some of this, is just people are overburdened. We have environmental health specialists who are doing a lot of true public health work, and they're not able to do as much of their true environmental health work. We have a registered sanitarian who has been leading our public health accreditation with FAB for the last 6 years and has had to take a step back from doing a lot of our inspections. And we inspect casinos, we inspect C-stores or convenience stores, all of our hotels attached to casinos, that type of stuff. So it's been sort of this overburdened process. And in public health and environmental health, there's always how do we marry the two of them, but not overlap in our services. So part of my position is to come help alleviate some of this. But people are just overburdened with a lot of work because we don't have the positions to fill or creating them. And I know in our government structure, it's a very long process to create a job posting. We have to send it through the legislator up to our tribal president, get that kind of approval. And there are pay restrictions with a lot of things based on our tribal budget and what we have allotted for that. So those sort of bureaucratic processes that we have to go to just to open up positions, and then you have to find candidates that fill them. For a lot of us, many of our service areas are rural. So not a lot of people want to transition into the rural realm. And also not a lot of people know that you can work in public health and environmental health with tribes. There's a whole entire awesome network. So branding and marketing what we actually do and what is available has been something that we're hoping to move forward with and get out there.
Thanks, Candace. Yeah, maybe that's something that we as a section can assist with in some ways. Andy, Is this the same case in New York City? And can you talk about your challenges? Thanks.
Yeah, definitely. I think I echo what the last two speakers mentioned, is that we've lost a lot of people due to COVID burnout in the last 2 years. And right now, all New York City staff is required to report in person full time, day in, day out, whereas we had a little more flexibility at the height of COVID. So we're also losing people because we've lost that flexibility in allowing for hybrid schedules. So we're still kind of in this archaic mindset that you need to be in the office in order to get things done, even though we've been able to prove otherwise in the last 2 years before this past September, when everyone started reporting back. So it's just really challenging to find good talent and to retain them, because we are up against so many more, attractive offers for people that pay more and that offer more flexibility.
If I could jump in real quick, I think that's nuts that y'all are required to report in person.
It's so nuts.
That we thankfully, Governor Lujan Grisham put out an order for emergency telework, right, when the pandemic started. And then it wasn't until August of last year that the option got switched to non-mandatory telework. So every single employee could request non-mandatory telework. And it varies by department, by state agency, but it's still an option. And I have employees that are doing like 2 days a week in, 3 days at home, and I will do everything I can to make it a possibility for them. And I think it's so important, like you mentioned, and I don't see why we should stop it. If anything, I'm trying to ask my employees to stop working at 5 rather than them not doing enough at home. So I hope that can change at some point. And you said you're in New York City, right? Yeah.
Yeah.
Gosh.
And for us, we cover such a large geographic area, so having people be able to work remotely, we're not having to factor in 6 hours of their day driving to a satellite office and back to the main office. So it's been an actual blessing in the ability to telework in time that we can get back into investing in our work that way.
Thanks for all your comments. Yeah, I mean, obviously, I think the workforce is transforming, or it has transformed, and it seems like not everyone's on the same page of how to continue this telework part of it. When it seems like it could be helpful to specifically public health workers. Thank you so much for your comments. I'm gonna move on to Elena's question. She hosts a environmental section coffee hour, and they were talking about how they could support environmental health practitioners. And I think they were discussing misinformation and disinformation in our age. And do you all want to talk about how you simplify environmental health and public health messaging and to combat this? And what do you think of this being an integral piece in the support of EH practitioners?
I can jump in. That's a really great question. So one of the new positions that we'll be working on in the next couple of years is actually dedicated specifically to like a health communications aspect of it, and translating information that comes from the environmental health practitioners and the public health practitioners and getting it out into our communities, and making sure that it's in Ho-Chunk language for our elders to understand, as well as in English for people who don't speak Ho-Chunk. So having a dedicated position to that, which again requires filling it, creating a job description and funding. So the idea in theory is there to help factor in a lot of this, but also for us, especially factoring in the aspects of medical mistrust and the history of public health in tribal nations, and understanding that there's not the savior complex with it. It's listening to your actual communities. So just sort of getting back to your roots and understanding what the communities want versus all these ideas that we have in our satellite offices and our little ivory towers. So finding people that are in the community, getting in the community ourselves, and being more hands-on with people to figure out how do we message things appropriately. And then also catering a lot to our youth. There are a ton of amazing tribal organizations across the nation who do a lot of work with youth. So when our capacity is limited, pulling in some of those organizations, we have a really great network of people that we can bring in to contract with things. So not trying to do all of it ourselves is another great way to look at it, and pulling in a lot of our resources.
I just want to also agree 100% with what you just said, Candace. A lot of our messaging is targeted to the most understandable reading level. I think the average reading level for New York City residents is somewhere in the middle school reading level, because a lot of people are English as second language speakers. So just making sure things are communicated in a way that's easy to understand, not too complicated. I think that is one of the biggest focuses that we have when we put out our information. Also making sure that we have very tight relationships with our communities that we reach out to and serve, because if they don't know us, they're not going to trust us. And I think we've learned that the hard way, that we need to be out there in the community. We need to be part of the community and have strong relationships with community partners. So that includes community health workers, because yeah, we cannot be everywhere, especially in a city this big. But just knowing who our stakeholders and partners are and establishing ties with them has been key, I think, to combating distrust of government. Can you hear me? Okay. And I just wanted to say one more thing that I found a little alarming. I was in a talk last week with somebody who works in health equity, and apparently there was a really large nationwide survey. I don't have it on me right now, but it basically said that Generation Z has no trust in government or in public, facing information. So that was an alarm bell for me, and it's just made us realize, whatever we're doing, we have to definitely just be more engaging with younger generations. We need to make sure that we're connected to them, and if we're not, they're not going to believe anything we have to say. So our work is incredibly challenging. So that's just something that I think about, is if you can't communicate things in a way that's going to help kind of mobilize action, then you're severely limited in your effect.
I have something to say, but I noticed Raquel, your hand is up. Is it something for something one of the speakers have already said?
I was just thinking about what both you and Andy said about language. I am an English as second language person, although I feel fortunate because I'm fluent in English, which is not the case with many. But I was thinking about other types of language, and I was thinking about if you can even approach, especially the youth, where they stay in terms of social media platforms they use. Like, I have a hard time engaging with my own kids in terms of the type of engagement they have with online everything, because my platforms and media of choice are different than theirs. And so I can make an effort, but it is an effort. And so I'm wondering about how challenging that is, and if you can even address those challenges by communicating with the youth in their platforms of choice.
I don't have anything to add to that, but I'll pause on Andy for you if you want to say something.
Yeah, unfortunately, my day-to-day work focuses more on families of, children who are at risk for, say, lead poisoning or, you know, adverse asthma symptoms. So I don't get to communicate so much to younger generations as I would like. But during COVID, that was something that we were trying to kind of saturate messaging at all levels of all generations. So yeah, the social media, I think it went to a certain point, but yes, there are platforms that we're not touching, right? So we need to just kind of meet people where they are. I 100% agree with needing to identify those areas and going into those as well.
For us, a lot of it is reaching out to organizations who already do this well. There's an organization called We Are Native who has an online sort of platform where you can ask an uncle or ask an auntie about health-related questions. They have a really huge TikTok following that puts out messaging related to health and asking those types of tough questions. So right now our division's not in a place to be putting out that information. We don't have the capacity or the resources. So taking the time to identify resources for us that are Native and promoting those on behalf of them until we can start to actually build up those platforms ourselves, and hoping to have a dedicated position towards that type of communication. A lot of times we tack it on to a line in someone's job description and they're overburdened with other things. So creating intentional positions related to health communication is something that we're hoping to move forward with and do.
I want to go back real quick to the original question, if that's okay. So in terms of disinformation and misinformation, I wish we were there. I don't think we are. We're struggling right now to put out communications in multiple languages at the same time, right? Usually the English version is coming out, Spanish 10 days later, and then Pashto or Vietnamese even later than that. And it's so inequitable. I think we're leaving folks behind and creating health inequities by not doing better there. So that's where I'm trying to get us first, and then we'll figure out the disinformation and misinformation thing. But that's a comment I had to that. And relatedly, with the Public Health Task Force, we're working on, like I said, recommendations to improve the infrastructure here in New Mexico for public health. And one of the recommendations is related to Essential Service 3 on communicating effectively to inform and educate. And I'm going to drop that in the chat just so you see kind of what we're trying, how we're trying to frame what we want to do related to communication, whether it's public or environmental health.
Thanks everyone. It's so interesting. Public health and environmental health workers are just burdened with a lot of really different problems and challenges. It seems like, and the misinformation thing is something we are all dealing with, I believe. I think George had a question. Did you want to go ahead and ask that before we close out?
I was just about to put it into the chat, but
well,
I just wanted to pick up on the communications. I really think that maybe it'd be a good idea to have somebody give a talk on this or a presentation because I was listening to NPR and they had a story about a course they're giving at Duke, and it's called the TikTok course. Of course, that's not the official title, but that's what the students call it, and it's about taking serious issues and getting them across using TikTok. Now, my dancing, not too good, so I haven't ever done TikTok, but I think a lot of, I think we as scientists and health professionals need to reach out, as we were saying, you know, where the people are. And that's where a lot of people are. And, you know, I know it's frustrating, the miscommunication, but if you look at polls of the public, as bad as it is for us, actually scientists and medical people are among the most trusted of sources, way more than politicians or religious leaders or, you know, just about any other category you can think of. I think generally nurses are held the highest because people relate to them more. But anyway, generally, you know, we are held in high regard. So it's incumbent upon us to actually get out there and say something if people are willing to listen, but we have to reach them where they are. So, you know, I do Twitter, but that only reaches a certain, you know, segment of the population. So maybe would it be possible to do something, have somebody out here, somebody in this group or that we know does this and could maybe share how to do it. That's all.
I think that's a great idea that we can put on the books and talk about with Natalie and talk about some other speakers that we could have. Thanks, George. I'm going to go ahead and we have 4 minutes left before we move on to the business section of the meeting. And I want to thank everyone so much. It's been incredible hearing your experiences and the joys and challenges of the work and also job opportunities. And so I just want to close out, if you could each just briefly talk about the field of environmental health and like maybe what you want to see change or what you see changing that you're excited about. I'd love to hear like those closing remarks, and then we can go ahead and move on to the business section. So anyone who wants to start, thanks.
Maybe others are thinking. I'll just say for me, my goal and my hopes for the field are to, I'm not sure, I'm sure all of you might have heard of this, but this idea of health in all policies. So that's very much where I would like to see this field go, where environmental health has a seat at the table for different types of public decision-making roles at all different levels. So that includes urban planning, that includes things you don't traditionally associate with environmental health or health in general. But I think it's very important, considering the environment's impact on health, that we make sure to have the right people present at those decisions.
I can jump in. One of the things that's most exciting, sort of, especially in the environmental field and environmental health field, tribal nations have been the pioneers of a lot of environmental health initiatives, especially related to climate change. So seeing that sort of grow as we've been in crisis mode for the last couple of years and transition a little bit. And for me personally in my organization, the overlap between public health and environmental health. I know in a lot of areas, especially in academia, there's this division between the two of them, but working in tandem together for me is really exciting, and hopefully in the field, in practice as well.
For me, I want to see environmental and public health be more representative of the communities that we serve. You know, Indigenous folks here in New Mexico are way underrepresented in state government. We can just do better, and I think we'll create better policy and programs if we're actually representative or even over-representative of some of the minority communities, right? Why just stop there at matching the population as well? I think that could really help, and that goes to like building pipelines, right, from high schools and you know, community colleges, universities, to really get people interested and hooked on public health. You know, remember how we were hooked on phonics? Maybe we need to do like a hooked on public or environmental health campaign, but someone who's more savvy than me can do that. Yeah, that's where I want to see us, and I think we can get there together.
Thank you so much. I'm sorry I missed your question, Natasha, but it sounds like some people answered it a little bit. And if you all, if the panel real quickly, our question was, what do you see as needs as new or emerging environmental health professionals in the workforce? If you all want to answer it in the chat, that would be amazing. But we're going to move on to our business section of the meeting. And I just want to say thank you again for sharing your experiences with us. We don't want to be like a monolith representing just one field or sector. You know, we want the section to be representative of all the things that the environment section can be. So thank you again.